Examination of the ear, nose and throat for the non-specialist. So let's look at examination of the ear. So the patient's hearing is assessed during the course of history taking. More formal education of the patient's ears is then carried out starting at the outer ear. So note major abnormalities of the pinna, such as total absence or marked aplasia, and then assess the position of the pinnae, hair symmetry, auricular skin tags, pits, and sinuses. The pinnae should then be deflected forward to examine the postoral region for scars, bony depression, and other abnormalities, including innocent swelling such as sebaceous cysts for more sinister lesions such as carcinoma. So you look for enlargement of the periauricular and post-auricular lymph nodes. The swellings of the pinna, exquisite tenderness may present with cellulitis or following trauma where subperichondral hematomata may cause the so-called cauliflower ear. So discharge from the meatus may cause a secondary eczematous reaction which may extend on the skin of the neck. So many abnormalities of size and shape of the pinna may be associated with various syndromes. So one of these is Treacher-Collins syndrome, in which there may be severe dysplasia of the pinna, and also the canal, as well as other facial features. So these include hypoplastic malae, anti-mongoloid slant of the eyelids, and this syndrome may be associated with severe degrees of conductive deafness. So the canal should then be examined using a suitable otoscope light. Examine the opening of the ear for discharge and note its nature. It may be thin and watery, as seen in some cases of otitis externa. Thicker mucopurulent discharge may indicate tubotympanic or mucosal chronic suppurative otitis media. Scanty offensive discharge is frequently the only symptoms of antral disease, a more serious type of chronic suppurative otitis media, in which the main pathological finding is the presence of cholesteatoma. The correct way of holding the otoscope will help considerably, as not only enabling a better view to be obtained of the deeper ear canal in the eardrum, but also reducing the risk of hurting and frightening the patient. To examine the left ear, the instrument should be held in the left hand, and the right hand then being free to retract the pinna, straightening the ear canal, improving visualization of the eardrum. Also, the ulnar border of the left hand may be rested upon the patient's cheek, so that should the patient move the examiner's hand holding the otoscope will also move and prevent the speculum impacting the ear. So while introducing the speculum, abnormalities of the ear canal may be seen, such as otitis externa, a furuncle which is extremely tender, a metal exostosis, that's bony swelling of the canal, and rarely tumors. If what is present, it may need to be carefully syringed away before further examination can take place. Always inquire of a history of discharge and non-perforation before syringing an ear. and the eardrum may then be examined. A healthy tympanic membrane has a shallow concavity with an antero-inferior reflection of the examining light, and the core of light narrowing towards the umbo and middle part of the membrane. The color is typically a pale gray pink, and the incus or stapes assembly may just be visible posteriorly through the drum. A central perforation in pars tensa will indicate the tubotympanic or relatively safe type of chronic suppurative otitis media. An attic defect is indicative of artichoantral disease, typically associated with cholesteatoma. And there is higher incidence of intracranial and other complications such as facial palsy in artichoantral chronic suppurative otitis media. So hyaline and chalky patches in the tympanic membrane are relatively common finding and are evidence of previous inflammatory ear disease.